If you are doing everything right, you are taking your metformin, you have cut out the bread, you are walking after dinner, but you wake up in the morning, prick your finger, and see a number that makes you want to cry, 140, 150. You think, how is this possible? I didn't eat any sugar last night. I need you to stop blaming yourself. You are not failing. Your biology is playing a trick on you. Most seniors, and even many doctors, focus entirely on what you eat, but they ignore the most critical factor that determines the thickness of your blood and the sensitivity of your insulin. They ignore hydration. And I don't just mean drink 8 glasses a day. That is outdated advice. For a person over 60, how you drink and when you drink matters just as much as how much you drink. I am Dr. Oleksii Kalmykov. In my practice, I have seen A1C levels drop simply by changing a patient's water schedule. Today, we are going to explore the hidden link between dehydration and high blood sugar. We are going to talk about why your brain stops telling you that you are thirsty after age 60. We are going to discuss the hormone that spikes your sugar when you are dry, and I'm going to give you a specific water protocol to lower those stubborn morning readings. If you are tired of unpredictable numbers, this might be the missing piece of the puzzle. Let's start with the physiology of the senior body. Why does blood sugar go haywire when you are dehydrated? Imagine you are making lemonade. You put 1 cup of sugar into a pitcher of water. It tastes sweet. Now imagine you leave that pitcher in the sun. Half the water evaporates. You didn't add more sugar. The amount of sugar is exactly the same, but now the liquid is twice as sweet. It is a syrup. This is exactly what happens to your blood. When you are dehydrated, your blood volume drops. The water leaves, but the glucose stays. Your blood becomes concentrated. This is called hyperosmolarity. So, when you prick your finger, the meter reads high not because you ate cake, but because your blood has turned into syrup. But it gets worse. When your blood volume drops, your body panics. It thinks you're in a drought. The brain signals the pituitary gland to release a hormone called vasopressin. In lower voice, vasopressin is a survival hormone. It tells your kidneys, stop peeing, save the water. But vasopressin has a nasty side effect for diabetics. It tells the liver to dump stored sugar into the bloodstream for quick energy to find water. So being dehydrated literally triggers a sugar spike from the inside out, even if you are fasting. Now, why is this a specific problem for seniors? Because your check engine light is broken. When a 20-year-old gets dehydrated, they feel thirsty. Their mouth gets dry, they drink. When a 70-year-old gets dehydrated, the thirst signal in the hypothalamus is blunted. You can be clinically dehydrated and feel absolutely fine. I see patients in my clinic with dry skin, dry lips, and concentrated urine, and they tell me, "But doctor, I'm not thirsty." You cannot rely on thirst. You have to rely on a schedule. This brings us to the morning spike, also known as the dawn phenomenon. This is the #1 complaint I hear. "Doctor, my numbers are highest in the morning." Here's why. You just spent 8 hours sleeping. You were breathing out water vapor all night. You were sweating. You probably got up to use the bathroom once or twice. You wake up in a state of mild dehydration. Your blood is thick. Your vasopressin is high. And your cortisol, the waking hormone, is spiking. If you wake up and the first thing you put in your mouth is coffee, you are pouring gasoline on the fire. Coffee is a diuretic. It pushes more water out. So now you are even more dehydrated and your blood sugar stays high all morning. Here's the morning protocol to fix this. Before you do anything else, before the coffee, before the toast, before the medication, I want you to drink 12 to 16 ounces of warm water. Why warm? Because cold water shocks the stomach and can slow down absorption in seniors with slower digestion. Warm water relaxes the gut and enters the bloodstream faster. By drinking this water immediately, you do three things. 1. You dilute the syrup of your blood. 2. You shut off the vasopressin hormone, telling your liver to stop dumping sugar. 3. You wake up your kidneys to start filtering out the excess glucose. I had a patient, Robert, 74 years old. His fasting sugar was always 160. I told him, Robert, put a tall glass of water on your nightstand. Drink it the moment your feet hit the floor. In 2 weeks, his morning average dropped to 135. No extra pills, just water. Now, let's talk about mealtime hydration. This is where most people get it wrong. They don't drink all day and then they sit down to dinner and chug 2 huge glasses of water while they eat. Important, this is a mistake for digestion. As we age, our stomach acid becomes weaker. If you flood your stomach with ice water while you're eating, you dilute the acid and the digestive enzymes. This slows down digestion. It causes bloating, and strangely, it can cause a delayed blood sugar spike because the food sits in the stomach too long and then dumps into the intestine all at once. The rule for seniors is drink before, not during. I want you to drink a glass of water 30 minutes before your meal. This is scientifically proven to help with weight loss and blood sugar. It prehydrates the stomach lining, which is made of mucus and water, so it can handle the acid. It fills you up slightly so you don't overeat, and crucially, it ensures your blood is hydrated before the sugar from the food hits your bloodstream. Think of your blood like a river. If the river is full and flowing fast and you dump a bucket of dirt, which represents sugar, into it, the dirt washes away quickly. If the river is a dried-up creek and you dump that dirt in, it just sits there and clogs everything up. Hydrate the river before you add the load. Now let's discuss what you are drinking. Many seniors tell me, I drink plenty of fluids. I drink tea, I drink juice, I drink diet soda. Diet soda is a trap. Yes, it has 0 sugar, but the artificial sweeteners can alter your gut bacteria. New research shows that changes in gut bacteria can drive insulin resistance. Plus, the sweetness tricks your brain. Your brain tastes sweet and prepares for sugar that never comes, which can sometimes trigger a small insulin release anyway. Water is the medicine. But plain water can sometimes run right through you. If you drink a glass of water and 5 minutes later you have to run to the bathroom, you are not absorbing it. It is just washing your kidneys. To get the water inside the cell, where it helps insulin work, you need electrolytes. I am not talking about sugary sports drinks. I'm talking about a tiny pinch of high-quality sea salt. Just a few crystals on your tongue before you drink or dissolved in the water. This salt acts like a magnet. It pulls the water into the cell. For my diabetic patients, I also recommend adding a teaspoon of apple cider vinegar to that pre-meal water. The vinegar helps sensitize the muscle to insulin, and the water provides the hydration. It's a powerful combination. Let's talk about the warning signs of silent dehydration. How do you know if this is affecting you? Look at your hands. Pinch the skin on the back of your hand. Does it snap back instantly, or does it tent and stay up for a second? If it stays up, you are dry. Look at your urine. I know we don't like to talk about it, but it is your best diagnostic tool. It should be the color of pale straw. If it is dark yellow or smells strong, your blood sugar is concentrated. If it is perfectly clear like water, you might be drinking too much plain water without electrolytes and you are washing out your minerals. We want that pale yellow balance. And watch out for false hunger. The brain signals for thirst and hunger are very close together. Often, when you feel a craving for a snack at 3 p.m., you are not hungry, you are thirsty. Your brain wants energy. It knows that sugar gives energy and water gives energy. It gets confused. Before you eat the snack, drink a glass of water. Wait 15 minutes. 80% of the time, the craving disappears. You just saved yourself a blood sugar spike. Now, a very important medical disclaimer. I am speaking to the general senior population. However, if you have congestive heart failure or kidney failure and your doctor has put you on a fluid restriction, like 1.5 liters a day, you must listen to them. Do not exceed your fluid limit. But you can still use the timing strategy. Use your limited allowance of water strategically in the morning and before meals, rather than sipping randomly. Let's summarize the senior diabetes hydration protocol. Step 1. The morning flush. 12 to 16 ounces of warm water immediately upon waking. No coffee yet. This fixes the dawn phenomenon. Step 2. The pre-meal buffer. 8 ounces of water 30 minutes before breakfast, lunch, and dinner. Add a teaspoon of apple cider vinegar if you can tolerate it. Step 3. The mineral hack. If you're peeing constantly, add a pinch of sea salt to your water to help absorption. Step 4. The caffeine curfew. Stop drinking coffee or heavy tea after 2 p.m. Why? Because caffeine stays in an older body longer. It disrupts deep sleep. Poor sleep equals high cortisol. High cortisol equals high blood sugar tomorrow morning. Switch to herbal tea or water in the afternoon. Step 5. The bedtime sip. Do not drink a huge glass before bed or you will be up all night peeing. But don't go to bed dry. Have a small sip, maybe 4 ounces, just to keep the throat moist and provide a little hydration for the night shift. I want you to try this for 3 days. Hydration changes happen fast. Keep a log of your morning blood sugar readings. See if that stubborn 140 starts to drift down to 125, then 122. You might find that your energy levels stabilize, that brain fog at 10 a.m. lifts, because remember, your brain is 75% water. If you are dehydrated, your brain is shrinking, literally. Hydrating is the cheapest, most effective way to improve your cognitive function and your metabolic health. I'm Dr. Oleksii Kalmykov. We don't just treat the numbers, we treat the environment the cells live in, and that environment is water. If this video helped you understand your body better, please share it with a friend who's struggling with their numbers. Hit subscribe so we can keep troubleshooting your health together. Go drink a glass of water right now. Your pancreas will thank you. I'll see you in the next video.